Hello, I'm David Kerr, Professor of Cancer Medicine at the University of Oxford. Amongst many other things, this year, 2023, marks 200th anniversary of the Lancet. We may know that the Lancet was first initiated as a newspaper, as a journal that campaigned in health issues. Nothing's changed. It still does under the editorship of Richard Horton, of course, very well supported by my good friend David Collingridge, who's done such a brilliant job with Lancet Oncology. I'd just like to have a look at a recent editorial that they wrote. It was on the back of World Cancer Day, and the title is that we should be less despondent, less gloomy than we should be about how we should deal with the global cancer burden. Again, it's a little about inequity. We know that there are stark differences in the way that we deliver cancer control in wealthy as compared to income-restricted countries. We look at childhood survival rates, which are 80% in the north, in the west, in the wealthy, compared with less than 20% in those low-income countries. And that can be replicated across the spectrum of all tumor types. I mean, it's all of cancer control. It's lack of awareness raising, ideas around prevention, lack of access to even the most basic treatment facilities, even the most basic diagnostic units, and very patchy end-of-life care, complexities with access to morphine, something that we've discussed on Medscape many times before. The editorial, I think, really gets to the root of it all. When we look at the dollar amount of assistance which is given around AIDS, HIV, infectious disease, it's around $9 to $10 billion a year compared to $1 billion a year across all of non-communicable diseases, cancer, cardiovascular, diabetes, respiratory. A sort of very marked difference. And it's interesting to think psychologically why that would be. Is it just that we think that cancer is an intractable problem, that we can do something that we can do a bigger part and nothing about whatsoever? That's not the case at all. We recently published our Lancet Commission on cancer control in sub-Saharan Africa, and showed that up to 40% of cancer, with the appropriate levels of awareness raising, early detection, preventive measures, vaccination, looking at tobacco control and so on, 40% of cancer could be taken out. This is not an intractable problem. That's the message that we need to promulgate and send. So we've talked again a little before about should we have a global cancer fund. I'm a proponent of that. I think it would give us a focus. It would give us a center, a grounding, an earthing that would allow us to be able to help support those countries which are struggling with the whole non-communicable disease agenda. Although we have the UN and WHO setting targets, how are we going to reach those unless we can provide support which is intellectual, which is practical, which allows us to meet the ambitious targets which have been set coming from the top down. So not much work to be done there. We know that when we've looked across many looking at low middle income countries have cancer control plans, but they're of immensely variable quality, and large numbers of them don't mention HPV, vaccination against what is still just the commonest cancer of women in developing countries, cervical cancer. We know that breast cancer is soon to overtake, and in many low-income countries, breast cancer is more common. But these are cancers that we can do something about. We look at Rwanda and we see the extraordinary success they have had with 90% coverage with their HPV vaccination program. But that's one country that stands out against a plateau of achievement elsewhere. So much to be done and to be corrected. And if we're looking at evidence-based national cancer planning, what we need to do is to provide milestones. We need to have the data collection systems in place. and we need to have a budget to help deliver that. And that's where something like a global cancer fund could come in. Have a look at the editorial. It's well written. It's thought-provoking, but it's not despondent. It says this is a problem that we can approach, that it's something that we can do something about, and that with foresight, that with investment, with the global community working together, we could make a difference. Have a look at it. Tell me what you think, and let me know of any comments or any other ideas that you might have that would allow us to pursue global cancer control. Listen, thanks for listening, as always. Post any comments that you might choose to, but for the time being, thanks for listening. Over and out. Thank you.